I spend the afternoon on a day when my afternoon's clear for editing or for doing patient videos. And so I'll be editing today. This is one, we may not leave this in because I make a funny face here. Okay, so she hugs me. We had this injection, and this is actually a video that we're going to put out this week. I was pushing the needle in, and oh my goodness, it kind of went, suddenly lost resistance and went in. Surprisingly, you could hear the patient, she didn't even feel it. You can see we got a lot of anesthetic, which allowed us to do the procedure of the toenail removal without any pain at all. So we're going to try to edit this visit that was, I don't know, 35 minutes down to 3 to 5 minutes. And that's what I spend a lot of my in-between patients doing, is getting this down to this. My patient that we didn't take the camera in, she was camera shy. It was a follow-up for hip pain, which resolved with physical therapy. And we didn't show her injection. We do a lot of hip injections on camera. We didn't do hers. And she was one that did not get better with it. There are some who don't. The success rate is probably, I would say, more than 80%. I hesitate to say as high as 90%, but somewhere in that range. That's how good the hip shots work. Within 2 visits of physical therapy, the pain's totally resolved and gone, which that's not typical. So she was atypical on not responding to the shot, and atypical on how well she did respond to the physical therapy. She has very high blood pressure. She'll have readings as high as the 180s at home, but then they'll go down to sometimes the high 130s. Still not ideal, but at least not terribly high. You just have to focus on exercise, because she does find it slower when she's regularly exercising. Avoiding caffeine, which she is already doing that, and then looking through her diet to see if sodium can be lowered. These are the other things that can be done to try to get this blood pressure down. And actually, I recommend doing those things first before adding medicines. Medicines should be the last thing. Lifestyle changes first. So that's how I spend my day. I hope that satisfied Claire Westmoreland's curiosity. And if other people have suggestions for videos, go ahead and write them in the comments underneath the description. We'll take it into consideration for doing all sorts of things. We're glad to have you here, and we're glad that some people had interest in what it's like for a normal day for Dr. Mark. So until next time, this is Dr. Vaughan telling you to stay in good health. Hey, thanks for watching this Day in the Life of Dr. Vaughan. If you have suggestions for our channel, please write them in the comments, or if you have questions, and please make sure you're subscribed to the channel. Until next time, this is Dr. Mark Vaughan telling you to stay in good health.